All right. Can you see my screen now?
Yes, looks good.
All right. Thank you. So I'm Alan Ulitin, and I am from the CHI Philippines Hub. For today's workshop, I and Emmanuel will be presenting crowdsourcing in health and health research. So by the end of this workshop, we hope that the participants will be able to understand the need for crowdsourcing open calls in health and health research, then identify potential areas where crowdsourcing open calls could be utilized, and lastly, understand key elements related to the organization and implementation of crowdsourcing open so Van Eyck defines crowdsourcing open call as distributed problem solving and production mechanism that leverages the collective intelligence of non-expert individuals and network communities for specific goals. She further described crowdsourced solutions as often proposed by those with direct experience of the challenge and thus are grounded in the realities of everyday life. The TTR also provides, which I think is a simpler definition of crowdsourcing open call, wherein a group of people attempts to solve all or part of a problem, then shares selected solutions back or implements them in the community. Crowdsourcing for health and health research differ from others because of its explicit emphasis on generating public benefit and banking on public creativity. Crowdsourcing open call generally offers advantages to improve health, including leveraging networks, sharing data, and expanding community engagement. Crowdsourcing open call often also save money compared to conventional public health approaches. Crowdsourcing open call are increasingly used to improve public health. A small but growing body of literature demonstrates their effectiveness. For example, crowdsourcing open call have been used to improve HIV and sexual health outcomes, to improve research mentorship in low and middle income countries, and collect best practices strategic planning during COVID-19, among others. You can easily look into these works in the literature. A successful crowdsourcing open call can be divided into a 6-stage process that includes assessing, organizing, engaging, evaluating, recognizing, and sharing. We will go over each of these stages in the succeeding slides. An important first step in crowdsourcing open call is considering whether a crowdsourcing open call is an appropriate method for solving a specific task. James Sorowicki suggests to look for 4 elements in the crowd to decide whether crowdsourcing open call would be an effective method or not. First, he suggests that there must be a diversity of opinions, meaning each participant bases his or her opinion on private information. Second, there must be independence of ideas wherein opinions are formed separately from others. Third, there must also be decentralization of information, wherein specialists must be from a variety of fields. And lastly, there must be a mechanism that exists for aggregating private judgments into a collective decision. Generally, crowdsourcing open call is seen as effective in solving health problems that have social or behavioral origins, like HIV and other sexual diseases, perhaps. Also, for health problems that need for a strong community engagement. An example would be communicable diseases like COVID-19, and health problems that can draw on a crowd wisdom. Once the suitability of a crowdsourcing open call has been established, a steering committee should be organized. This committee, which would provide leadership and guidance, could include local community members, health professionals, community-based organization leaders, or private sector private sector leaders. It is also important that committee members should not all be from the same field or contribute a similar knowledge base. It is also essential to include individuals with direct or personal experience with the problem at hand, such as group of patients or at-risk groups to be included on the steering committee. The steering committee establishes contest rules and creates a call for entries. They also decide on the contest rules, including the purpose and criteria for evaluating the entries. Contest rules should delineate entry requirements such as word limits of the entries or video file size limits if the entry are in the form of a video, for example. Selecting an appropriate price structure is also important to encourage the crowd to submit their entries and to participate. Prizes may include cash prizes, but more importantly, prizes should include commendations and mentorship opportunities for the participants. Given that most people are also unfamiliar with crowdsourcing open call, promotion is very, very much important in engaging community members to contribute and to submit their entries. The process of community engagement typically involves the development of a social media announcement and in-person activities. These activities may include educational workshops at local universities, for example, or feedback sessions or information drives or sessions for individuals developing these entries. These are both in-person and online activities are essential for promotion of crowdsourcing open call. After the submission deadline has passed, entries will be evaluated. Judging process can be conducted in 3 phases. This include eligibility screening, crowd judging, and panel judging. In phase 1, at least 2 independent judges examine all entries and assess for eligibility. These judges evaluate each entry based on pre-specified criteria. In the second phase, in phase 2, the crowd judging phase, a crowd of lay people, for example, evaluates each entry. And in the last phase, in phase 3, a panel of experts and non-experts individually judges each remaining entries. The judging panel can consist of community steering committee in addition to additional key stakeholders. Each entry should be evaluated independently, but by at least 2 and preferably 3 independent judges. Once entries have been ranked based on the panel judges' scores, a qualitative summary consisting of feedback and comments of the finalists should be collated and presented to the larger steering committee. Ultimately, the steering committee will make the final selections, informing and notifying each participant about the decision regarding their submission and making a public announcement of the selected submissions or the winners of the crowdsourcing open call. Social media networks and other networks should be utilized to announce the winners or to recognize the finalists. After the crowdsourcing open call has officially ended, sharing solutions with local or national agencies and implementing institutions, remarkable entries and ideas can also be presented at academic conferences, research forums, and other public platforms. Although there are advantages of crowdsourcing open call, there are also risks associated with it, and challenges can happen at any of the 6 stages. Some of the risk may include failure to organize steering committee, which can be avoided by forming a steering committee which is responsible for the overall direction of the open call. there can also be failure to engage the community. You can mitigate this by refraining from using a single platform for promotion or distribution of the open call, by not limiting the contest to a specific group of people, and not restricting submission period to a shorter time period. You may consider extending the deadline of submissions, for example, depending on the yield of your received entries. There can also be poor judging of entries. You can avoid this by developing an appropriate judging framework. And of course, a poor implementation of the crowdsourcing open call, which can be avoided if you have transparency and implementation process and a collaboration between and among networks. At this point, I will give the floor to Emmanuel to discuss more on the applicability of crowdsourcing open calls. Emmanuel?
I don't know if Emmanuel is having a little bit of technical trouble. Let's see. I don't see that he's on the call, so I think he's having some technical problems. Alan, do you want to take the slides from here, or do you want me to present the last few slides? I did look at the slide deck.
Manuel just joined us.
Okay, great.
So thank you so much, Alan, for the presentation. And, sorry, I dropped
Can you
out,
guys
but
switch the
I'm back.
slide mode so that it's presenter mode? Is that possible? Perfect. Thanks, Emmanuel.
So crowdsourcing open calls are used in several different settings. And when it comes to strategic policy planning, where we have seen that open calls have been used to identify case studies of successful programs, which has been translated to policy and scaled up. And open calls have been used to inform the development of culturally acceptable public health interventions, which address the needs of the local populations. And these interventions have been in the areas of diagnosis, surveillance, health promotion, nutrition, and among others. And from the research viewpoint, open calls have been used to better understand community attitudes, behaviors, and beliefs related to health. And these open calls can be used to enhance community engagement by fostering trust and cooperation between the health leaders and the local community. So why evaluate open calls? Just like any other programs or projects, it is also important to evaluate these calls so that we can be able to determine whether we achieved our goals or purpose, and to identify components which works or those which do not work and why, and also see where we need improvements. So how can we evaluate these crowdsourcing open calls? there are a number of ways in which you can be able to evaluate these calls, including randomized controlled trials, qualitative research methodologies, and also quantitative studies. Although randomized controlled trials are expensive and time-consuming, but they are the gold standard for evaluating the effectiveness of crowdsourcing open calls. And when you come to qualitative research studies, these have an advantage of adaptability and responsiveness to the local contexts. And themes generated from these studies can provide more context on implementation. And so social media analysis may also complement these qualitative methods. Also, quantitative studies are important as far as evaluating crowdsourcing open calls is concerned. And we can use metrics such as number of individuals who viewed the call announcement, the total number of contributions received, and also the quality of contributions. So now we go to the essential requirements in organizing these crowdsourcing open calls. Number one is the human resource. This one is very, very important because the administrative staff will help in meeting the logistic and the communication and coordination activities. They'll be able to receive, as the entries come in, they'll be able to respond to the questions raised by the public. They'll be able to provide more feedback concerning the call, so they are so important. Also, diverse networks are of great importance for creating a strong steering committee, distributing widely the calls for entries, and also sharing the solutions. Imagine having like a network of public sector, private sector, then you have the non-government organizations, and you have the community-based organizations. Really, if you have like such network, you can expect to get many entries and also quality submissions. And then the third one is the champions of the cause. Like these are the people who are really affected by the problem you're trying to solve. So they are so important because they can help to nurture trust in the open call, and they can also serve as the core members of the steering committee. So according to Harry and colleagues, they came up with a consensus statement funding, so crowdsourcing. And the first one is that to decide whether this cross methodology, so it's the right in the to problems and go ahead and form the committee. That's just like the way Alan explained. And then afterwards, you have to promote. And when you are promoting the content, you have to give the public all the relevant information, the purpose of the call, and the expectation, the timelines, the rules, the criteria for evaluating the submissions, and also the prizes, as well as the frequently asked questions. So all this information should be available on all the platforms that are used to promote the call. And then also assessing the contributions is also very important. And here the steering committee can also set like guidelines which will be used to assess these contributions as they come in. And then recognizing the contributors. So at the end of the day, the submissions have come in, you have to recognize people who submitted their innovations. And also after evaluating the submissions, you have, and you get the finalists, you have to go ahead and recognize the finalists. And also the judges, people who help to judge these submissions, they also need to be recognized. And then the other one is sharing and implementing ideas. So it is very important to disseminate the ideas which have been generated through crowdsourcing open calls, and be able to implement the ideas where it is appropriate. And then lastly, it is evaluating these crowdsourcing open calls. So I invite Alan to proceed with the presentation.
Yeah, thank you, Emmanuel. So let me just share my screen again. I'm sorry, let me just fix my presentation. All right, can you see my screen now? Sorry.
Yep, looks great.
All right, so one of our recent works in the CHI Philippines Hub is an open call for youth social innovation during the COVID-19 pandemic in the Philippines. It is a quantitative and qualitative descriptive analysis from a crowdsourcing open call and online hackathon. This project was a collaborative work among our partners, including the SESH and the World Health Organization, Western Pacific Regional Office. We acknowledge that the COVID-19 pandemic has had a profound impact on youth, especially on their health. But despite this fact, the current COVID-19 response limits the extent to which youth have been engaged to address health challenges during the pandemic, especially in low and middle income countries, including ours in the Philippines. As we also acknowledge that the youth themselves can be active agents of change, the scenario being for the need to engage them in addressing these health needs and challenges through social innovation. For the purpose of our crowdsourcing open call, we define social innovation in health as a solution implemented through diverse organization models. The solution has been developed by a range of actors in a response to a systemic challenge within a geographic context. In partnership with the WHO, other academic institutions, youth organizations, and civil society groups, we conducted a crowdsourcing open call among Filipino youth using a structured TDR and CHI process. The open call has had three categories. The first one is youth voices to co-create the post-COVID-19 world. Entries we received were text, images, videos, and music. The second category is the youth-led COVID-19 social innovations and youth-led social innovations not related to COVID-19, which is the last category. To facilitate the implementation of the open call, we organized a steering committee composed of representatives from multiple sectors and fields, including medicine, public health, health service delivery, youth development, social and behavioral science, social entrepreneurship, social development, and futures thinking and literacy. We partnered with different organizations and community groups to achieve a wide reach of our open call across the Philippines. We also utilized digital platforms such as Facebook and Twitter to promote the open call. Each entry that we received were then evaluated by 3 independent judges. Finalists were selected in each of the categories alongside the grand winners. All finalists were invited to attend a one-day online civic hackathon to recognize and share their work and innovations. The online hackathon also provided the participants mentorship to further develop their ideas. We received a total of 113 entries from a total of 71 individual participants and 22 youth groups. There were 76 entries under the first category, 17 for the second category, and 20 for the last category, which is the social innovation entries that were not related to COVID-19. Interestingly, a few entries tackled mental health. The mental health challenges that were highlighted include isolation or lack of social interaction during the lockdown period, and increased cases of anxiety, depression, self-harm, and suicide also. This affirms the findings of recent studies that identify COVID-19 pandemic as having significant impact on youth mental health. In fact, one of our winning youth-led innovation entries aims to address health issues. It is a personal printed journal called "This Book is So Boring." It is creative social innovation developed by a local adolescent nurse in one province here in the Philippines. Ultimately, our key findings from our youth open call suggest that Filipino youth ideas and innovations were able to provide us insights into the youth's present experience during the pandemic, and also presented how they foresee their future after the pandemic, highlighting the issues relating to work, their family and education, their social interactions, and also the external environment. As a recommendations from our findings, our youth open call and online youth civic hackathon have several implications, both for research and practice. Our data have applications for programs and policies as well. We propose our findings to be incorporated into our Ministry of Health's program on healthy schools and communities under the health promotion agenda. This may include several novel solutions that we were able to identify, such as a personal journal called "This Book is So Boring." Further, we propose these youth-led social innovations and youth ideas to be integrated into community health programs at the municipal and barangay levels. I hope our exceptional innovation entries also open opportunities for implementation research to assess their quality and impact on improving specific health and development outcomes. And finally, our experience suggests that the need for a national and global youth open call to amplify the youth voices in response to the pandemic, and also to other health needs and development challenges, bringing in the youth ideas to inform future programs and policies. So thank you for your time. So at this point, we would like to request all the participants to go to the link as shown in the screen and answer a few questions based on our lecture. You can access the questions using the code in the screen. I will be also sharing the link and code in the chat box. All right.
While we wait for people, Alan, Unju in the chat box said she wants to get her hands on this book. Is so boring. Is there any way, is there a website or another resource that we could direct her or others who are interested in the boring book?
I don't think that the work is already public and published and available to the public, but you can send us your contact details perhaps, and we can connect you to the lead innovator of the journal. This book is so boring. Yeah.
And sorry, I didn't mean to put you on the spot, Alan.
No worries.
But the other point, the innovator is, I know they're very keen on expanding out and digitizing the project. I think, like Alan said, they're not quite there yet, but right now it's a print book. But yeah, if you're interested, just you could I'm happy to introduce you to Ujunwa. If you want to send me an email, I can introduce you to her. Sorry, Alan, back over to you.
Yeah, all right. Can you see the screen of the quiz, Mentimeter quiz?
Yep.
Yes.
I think we are already receiving some answers from our participants. So for the first questions, what are the essential elements needed to organize a challenge contest? For example, open call and innovation challenges. First, is it A, administrative staff, B, diverse networks, C, champions of the cause, D, all of the above, and E, none of the above? So we're getting most of the answer is D, all of the above. Okay. I think I can now show the correct answer for this question. All right. So majority of the participants got the correct answer. It's all of the above. We all need administrative staff, diverse networks, and champions of the cause for a successful open call, crowdsourcing open call. Next question. For an open call to be termed as a wise crowd, which of the following is most important? Is it number of submissions received, quality of submissions received, number of members on the steering committee, or D, quality and quantity of submissions received? Answers are coming, and we're getting a lot of choices for letter D. Keep your answers coming. All right. All right. So the correct answer for this question is letter D. Majority of the participants got the correct answers. Quality and quantity of submissions received is most important for an open call to be termed as a wise crowd. All right, let's proceed to the next question. So for the succeeding questions, we have a scenario. SIHA Uganda, together with the Ministry of Health, are organizing a crowdsourcing open call for innovations on maternal and child health in Uganda. Based on your knowledge on crowdsourcing open call, please answer the following questions. First,
And actually, sorry, Alan, is it possible to go back to the last slide so that you don't see the, yes, perfect.
Okay.
Can you just leave it here? And then
All right.
we can have an independent, we'll certainly be able to see the answers, but I think some people wanted the suspense. Ba, 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 the drum roll. Yeah, and for some reason I can't vote either.
All right.
Is it possible to, oh, it looks like that's weird. Some people can vote.
Yeah, sorry.
Maybe if you, for the next one, don't stop sharing, maybe try stop sharing your screen for, and
So for the first questions, who are the potential target audience for this open call? Are they students, local community members, community-based organization, representatives, researchers, health workers, government workers? Or B, students, community-based organization, representatives, researchers, health workers, and government workers? Or C, community-based organization, representatives, researchers, and health workers? Or D, non-governmental organization, representatives, researchers, and health workers? And the correct answer is letter A. Yeah. For the next question, which of the following group of people should be considered for a crowdsourcing open call steering committee?
Excuse me, Alan. I request
yes.
the first answer the question, then you can show the answers later because they can be able to copy as the responses come in. Maybe we can share the
All right.
answers later.
Okay.
Maybe participants, if you could take a few minutes and then you complete the question, then you can be able to go through the answers, please.
I'll put the link for anyone who's having trouble getting into the Mentimeter. Here's the link again. We put on our Jeopardy music. And actually, the other thing, it would be fine to read the question. Maybe do you want to read the question, Alan? And then by the time you read it, I think people will have had enough time to.
All right. So the question is, in a given scenario, where in Uganda will be conducting an open call on child and maternal health care, which of the following group of people should be considered for a crowdsourcing open call steering committee? Is it A, public health and medical professionals, B, community-based organization leaders, C, social scientists, D, local community members, E, all of the above, F, options A, B, C, or G, Options A, B, D. All right, I think all participants are able to answer, so I can now share. All right, so 67% of the participants answered letter E, all of the above. Okay, the correct answer for this question is, all right, stop clicking, sorry. Yeah, letter E, all of the above. So public health and medical professionals, community-based organization leaders, social scientists, and local community members can be considered as crowdsourcing open call steering committee. All right. So for the next question, after setting up a steering committee, the role of the steering committee includes the following, except A, establishes the purpose of the open call. B, sets up the criteria for evaluating the entries. C, show to the public examples of successful ideas. Or D, select a price structure. Again, after setting up a steering committee, the role of the steering committee includes the following, except for letter A, establishes the purpose of the open call. B, sets up the criteria for evaluating the entries. C, show to the public examples of successful ideas. Or D, selects a price structure. Again, the role of the steering committee, except A, establishing the purpose of the open call. B, setting up the criteria for evaluating the entries. C, showing to the public examples of successful ideas. Or D, selecting a price structure. Okay, I think the answers are in. I can now share the results. All right. So for this question, majority of the participants answered letter C, show to the public examples of successful ideas, followed with letter D, selects a price structure. The correct answer for this question is, yeah, letter C, show to the public examples of successful ideas. So again, the steering committee are responsible for establishing the purpose of the open call, setting up the criteria for evaluating the entries, and selecting the price structure. Showing the public examples of successful ideas is beyond the role of the steering committee. All right, I think we can go now to the last question. Okay. What channels should be used to promote the call so that CHI Uganda receives innovations from all parts of the country? Is it A, social media, B, radio advertisements, C, in-person events such as workshop, community-based introductions, or D, all of the above? Again, the question is, what channels should be used to promote the call so that CHI Uganda receives innovations from all parts of the country? Is it A, social media, B, radio advertisements, C, in-person events such as workshops, community-based introductions, or D, all of the above? Sharing the results. All right. 99% of the participants answered letter D, all of the above. Okay. The correct answer to this question is letter C. So CHI Uganda can use social media, radio advertisements, and in-person events such as workshops, community-based instructions to ensure that their call can reach a wide audience, and they will be able to receive innovations from from all parts of the country. So I think that ends our short quiz. Thank you so much, everyone, for participating.
Fantastic. That was great, Alan. Should we do you guys want to take a few questions since we have a few minutes, or what's next?
Yeah, I think we can answer some questions or comments from our participants.
Fantastic. If anyone has a question, well, I think what I'd like to do, I'll start with one question, but if people have questions, feel free to put them into the chat box, and then we can, we do have about 10 minutes here just to sort of go over questions. My question goes back to the Ugandan example of like a CHI call about social innovations relating to maternal and child health and organizing that. The last question mentioned in-person activities, radio promotion, a whole bunch of different types of promotion. What about the last mile, sort of like getting into very rural areas? I know some people do have radio, and even if they don't have good bandwidth, you can sort of reach into some of these communities. But Emmanuel, I'd be really interested to hear your thoughts, and actually Alan too. How do you reach sort of individuals whose bandwidth is poor or who don't have good, they're just not as savvy about social media? How can you reach into those kinds of networks? And I don't know if Emmanuel is having technical problems. Alan, do you want to start off?
With their experience in youth open call, that was one of the limitations actually that we have identified. We are not sure if we reached enough number of youth, or we reached other youth groups, especially those in geographical isolated areas. To be honest, we did not go beyond posting our open call promotion in social media, but I think it will help if we can. But if we can also like have printed promotional materials and distribute them through the networks. One important strategy perhaps that we made was to contact and collaborate with a network of doctor to the barrios, doctors that are deployed in geographic isolated areas in the Philippines, and ask them to ask them to help us with promoting the open call, especially in rural areas in the Philippines. But we, unfortunately, we did not monitor or recorded their feedback on whether they were able to reach a specific group of youth in isolated areas and rural areas in the Philippines. But I think that would be an important strategy that can be considered to ensure wide reach of audience or community members to join and participate in an open call, crowdsourcing open call.
Thanks, Alan. And I don't know, Emmanuel, are you, if you're able to unmute, do you have anything to add?
Okay. Thank you so much for the question. So for the case of Uganda, Like in most of the regions in Uganda, even including those rural areas, they also have access to radios. And in most of the regions and the districts, there are radio stations. So in this context, to be able to use the radio stations to promote the core. And also when you go to these districts, they have what they call the district health officers, and also they are what we call the community-based officers. And these community-based officers, they know all of the organizations, and they also register all the projects which are being implemented in the district. So those are the people whom I'll be able to use also to try to help us and reach out to other leaders, to other local leaders, and also religious leaders to promote the cause. So also in person, this could be used to promote the core. That's all.
Thanks, Emmanuel. Thanks. And I agree with both of you. It's make a lot of good points. It can be a challenge, and really, I think this also reflects on the composition of the steering committee. If you can get people in these remote areas on your steering committee, or get the village leaders, or get some of these radio announcers or radio stations involved, then it can enhance promotion through those networks. If I know there are now several excellent questions in the chat box, and there's one person whose hand is up, and I would, let's see, why don't we take another couple of questions from the chat box? We had a question about, can crowdsource be used for policy making and in other subjects like agriculture, or is it only following health interventions? Alan or Emmanuel, do one of you want to respond to that?
Okay, thank you so much for that question. Actually, crowdsourcing can be used in different sectors, and it has been used in agriculture. It has been used in disaster management. Yeah, it has been used in health intervention. So crowdsourcing can be used in has been used in different sectors.
Yeah, I agree, Emmanuel. It's really, in some ways, it spread more widely through non-medical, non-public health areas, and it's really almost more from the world of tech and business. That's where it was developed earliest, in its earliest forms, and in the past few years, it's been used more widely to develop participatory interventions. Alan, do you have anything else to add about applications of crowdsourcing or outside of health, where it's been used, how it's been used to inform policy? In I mean, I think the amazing example from the Philippines is your National Social Innovation Award. It's a great example of a crowdsourcing open call that's actually been institutionalized and now supported by the government. Do you want to, or anything else to add on that note, Alan?
Yeah, I agree with Joe and Emmanuel that crowdsourcing can be applied in different sectors, including agriculture. It's actually a non-government organization in the Philippines who conducts crowdsourcing open call across sectors, including agriculture and health. And also shared by Joe, CI Philippines Hub is also part of the National Secretariat in implementing the national call for social innovation in health. It is called the Helia Castillo Award for Research in Health and Innovation, the GCARC. I think our team members are also joining. My team members are also in this meeting, and we're actually ongoing implementation of the GCARC, we are in the stage of, we have just closed the submission period and we are now in the screening process of the entries. And as of now, we have received a very, very promising entries. So yeah, crowdsourcing can be used and can be effective method for crowdsourcing ideas, even outside of health and public health.
Great, thanks, Alan. And now I realize we're right up against the hour. I'm just gonna give the floor back, and actually, Dr. Cuervo brings up a great point. There was a whole article in our recent special supplement of BMJ Innovations, and thanks for putting that link into the chat box, Dr. Cuervo. It's a nice article that goes into more detail about what Alan just mentioned, which is this Castillo Award and how it was developed and institutionalized. And I would highly recommend that read. It's worth looking at for sure. And then the other announcement, our speaker next week will be Dr. Elizabeth Chen. She is an assistant professor at the Gillings School of Global Public Health at UNC, and she's going to be talking to us about user-centered design. She's done a whole bunch of workshops on these and this topic. She's really fantastic. And the other important thing is we do have a very brief survey, and Rainer's just put it into the chat box. You just click on the link, and it's very brief, but this is helpful. And apologies for the technical issues, and thank you for your patience. We've got a huge number of people on the call, and I've been blown away at how smooth it's been, to be honest. This is like totally the silver lining of COVID. You know, you can have 300 people in a room talking about an exciting topic. So a warm round of applause again for Alan and for Emmanuel. Thanks for that excellent presentation. And for those of you who are interested in the archive talk, that'll be on the website. The PDF version of their PowerPoint is already posted. It's also on the website. So thanks again, everyone. Have a great day.